everyone. My name is Jen Sharon, NHIA's Chief Operating Officer and your moderator for today's 8th education session in our NHIA Summer Series, the 4 C's of Patient Collection: Change, Coach, Cater, and Collect, sponsored by NHIA FIAC and Gold member Brightree. This is the last education session in our summer series, but we do have some great education planned for you in the coming weeks and months. Please watch Express for registration information. Before we get to the housekeeping reminders, I wanted to take a few minutes to talk about the newly released NHIA Fellow Program, which was launched 2 weeks ago. The Fellow Program is a prestigious new program that recognizes the contributions and achievements of highly accomplished home and specialty infusion professionals. In its inaugural year, the program will recognize selected participants for their industry excellence and provide them with an opportunity to foster and mentor future industry leaders. Both clinicians and non-clinical professionals in the home and specialty infusion industry that meet the program criteria are encouraged to apply. Applications for 2021 class are now being accepted through September 15th, 2020. Just a couple of housekeeping reminders. The presentation is available for download from the handout section of the navigation pane, as well as the speaker bio. The webinar will be recorded. A link to the recording will be emailed to you following the conclusion of the webinar and will also be available via NHIA website in the next 24 hours. In order to receive CE, please follow the link in the follow-up email and answer a short quiz. Following the presentation, we will have time to answer your questions. Please submit your questions via the question tab in the navigation pane at any time during the presentation. At this time, I would like to again thank Brightree for their generous sponsorship of this program aimed to give you practical information on patient collections. I would like to introduce Paul O'Toole, Brightree's Senior Director of Business Development, Strategic Initiatives, who's going to tell us a little bit about Brightree and introduce our speaker. Paul, I'll hand it over to you.
Thanks, Jen. Hello, everyone. I'd like to thank you all for joining today's NHIA Summer Education Series webinar, the 4 C's of Patient Collections. Brightree provides cloud-based technology that thousands of HME and home infusion providers rely on every day to boost business performance and deliver better health outcomes. Our presenter today is Jennifer Leon, Vice President of Brightree Patient Collections, where she leads a team of experts in helping providers collect and retain more private pay. Jen has held a succession of positions, enabling her to develop a deep understanding of the private pay collection process, including best practices for optimal operational performance. We have a lot to cover today, so I'm going to hand it over to Jen to begin the presentation. Thank you.
Thanks, Paul. Thanks, Jennifer, and thanks, NHIA, for the opportunity for me to speak to you today. I know we're all going through unprecedented times, and so I do appreciate very much the ability to still get the message out, still get better practices out to those of you that we may have seen in person at the conference, and hopefully by having the webinars allowed those that were unable to travel even in normal times, the ability to watch and listen and learn. Excited to present to you guys today over technology and solutions that can help you collect more patient collections. I know that some of you may know me from the industry and I may be new to you, so hopefully in the future we get a chance to meet in person at future NHIA conferences. So I'm going to jump right in today. I am going to be speaking about the 4 C's of patient collections: change, coach, cater, and collect. We will have plenty of time at the end for questions, so please do submit your questions through the chat, and we will address those at the end of the session. So some of the learning objectives we will cover today is we're going to just look at a very high level, kind of a 30,000-foot view of what your current collection strategy may look like. Many of you may have already changed those strategies, especially during this time of uncertainty. Some of you may have been working towards that goal of changing your strategy, and then it was, bumped to a later initiative just due to the pandemic. But we're going to just kind of look at what that might look like from a 30,000-foot view. we're going to talk about and hopefully place ideas in your minds of how you can change your policies to encourage better collections from patients. And then we're going to learn to develop some of those internal training talking points. I find that sometimes we work in silos instead of working as an entire organization, as a group. And so what I have found in my experience out in the field is that tends to happen more times than not. And some of the C-level team, the management team, may not realize it. So hopefully that will open your eyes to how we need to work together as a team. So the first C that I like to focus on is the changing aspect of it. And, why are we changing? I really, like to, and if I was in person, I speak with my hands a lot. And so I really like to hammer home a few stats that I was able to gather about just patient collections in general. And if you think about your own patient collections experience with whether you are the patient yourself or just your own experience working in your current day-to-day, I think a lot of these will really hit home for you. I'm just going to read through a few of these, and you guys will have these in the slide. Patient out-of-pocket costs have tripled in the last 10 years. Of course, we all know that. Healthcare costs are at an all-time high with high deductible healthcare plans. So that is, we all believe that to be the case. 60% of our patients walk out of the door without paying a dime. Now, I know in my own consumerisms, in my own healthcare, I can't walk. I live in Kansas City, and everywhere I go, every healthcare provider, whether it be a dentist for my children, whether it be my kindergartner's shots that he had to receive to go to kindergarten, or whether it be going to the hospital to have a medical procedure, whatever it might be, I'm always asked to provide some sort of card on file before I leave. And we're going to talk about that a little bit today, but we need to change, we need to follow suit here in our own industry. We need to really think, okay, how can we secure the services and the assets we're providing to our patients in a manner that is appealing to them, and it appeases our bottom line. Healthcare bankruptcies are at an all-time high. In the yellow box, 4 times more expensive to pursue debt after the fact, or after to pursue debt rather than to receive a payer reimbursement. I don't think that used to be the case. We used to think, and even still, we have challenges working with payers. We have challenges in that regard, but it is a lot harder to collect from those patients than it is from those payers anymore. And I think that it used to be the opposite a few years ago. 50% of those patient responsibilities go uncollected. More and more people are wanting to pay their bills online and have an easier way to pay. In a study that was done with providers just in all facets of healthcare, it's taking more than a month or more to collect those balances. And then also, when you think about your patients, just think about yourself as a consumer. We want what is easy. We want it easy to pay. We want a very transparent solution with our financial commitment. And so if it's not easy for us as the patient, then we will consider moving to a better experience. And so that's really something I want you guys to kind of focus on is, are we, and ask yourself this question during the webinar, is are we actually providing these types of solutions to make it easy for our patients? And if you aren't, definitely consider that. So how are you collecting today? What are you're setting the expectation up front, or are you billing and chasing? Are you telling the patient when you see the patient at the initial date of service that they are responsible, they will be responsible for some financial commitment? Are you saving a form of payment? Is your system allowing you to save a form of payment, making it easier for your billing team to collect that balance afterwards? Or are you in that bottom bullet where you're still just billing and chasing and you're hoping for the best? Your patient said, no, I'd rather you just send me the bill, and then you send them the bill, and then you may or may not get paid. It's a crapshoot, right? It's 50-50 chance. So if you are collecting up front, though, of course, that's where the session is going to focus on today. I just wanted to kind of get everybody's brains thinking about how you might be collecting at current state. Of course, the patient's financial expectation, we all know what the patient thinks is these 3 things. It's either my insurance will cover it, right? Because I have insurance, or maybe I have a dual coverage even. I can tell you now, in a story I'll share a little bit later, insurance does not cover everything, as you guys well know, but the patient may not believe that. And so it's really comes to how are we going to better educate our patients? My doctor told me, didn't say anything about me having to pay anything, or my doctor told me I wouldn't have to pay anything, or I can't afford this. And so hopefully there will be a charity waiver or a write-off. And I think that those are just standard patient expectations. We as a healthcare unit have taught patients not to pay their first bill. I mean, it is what it is. I mean, we all believe that insurance is going to cover it. And so we've not needed to, provide a payment up front. I will say when I was, I was a late mom. I became a mom at the age of 30, and, I'm now 40, in my 40s. And when I think about what it was like to have my first child compared to even 5 years later when I had my second, healthcare had changed in that every appointment, they weren't asking me for a form of payment. And then after I had my second child, things started to change. And I think we're going to continue to see that change. And I want to make sure that our industry is able to keep up and stay with the change of the financial commitments within healthcare. So the next C that I wanted to cover is coaching. And this is internally and externally, right? So as I kind of mentioned, healthcare has taught us not to pay our bills because, and I've got bills sitting here on my desk now, I tend to question the system wherever the bills come from. And it's because we don't trust, the billing, right? We don't trust that the first bill is going to be correct. As a patient, I may sit here and say, well, I don't know that they billed me correctly. I don't know if they billed my insurance correctly. And so it really is about coaching your patients. And where is the prime time for us to do that? It is at the point of service. So we have to have strong and clear and concise communication at that point of service with the patient upon the initial consultation. We have to educate the patient. Talking about paying for stuff is uncomfortable for some people. You're going to find that you have better people in your organization that are suited for that versus others. And I would challenge you to look to those strengths of those staff members that don't have a problem talking about financial commitment, and make them the financial liaison. Make that a conversation that the patient must have before leaving your organization, before getting their equipment, their drugs, their services, whatever it might be. Make sure that they are having that one-on-one conversation with the financial liaison, explaining payment options. And then also a lot of providers have moved to a format of having the patient sign a financial agreement. I sign, like I said, when I live in Kansas City, and it seems as every healthcare provider I see, I always have to sign some sort of financial agreement. They're not asking me to necessarily give a card or provide a bank account in all of the different areas of healthcare that I frequent, but they are asking me to sign a financial agreement agreeing that whatever insurance doesn't pay, I'm going to be responsible. Now, I would suggest that you follow up with that by securing a form of payment on file and advising the patient, we are going to keep this payment on file, this method of payment on file. We will not charge that method though, of course, until you have a responsibility come due. And of course, always tell them that they should receive that information from you prior to their card just being blindly charged. When you clearly communicate with the patient what your billing process is, their defenses immediately go down. When they feel like they understand what their commitment is, how you guys will bill them, and how you will inform them prior to being billed, when they feel comfortable with that, their defenses go completely down, and it's going to make your billing and intake teams' jobs a lot easier. Price estimates are a big thing. Everybody wants to know, what is it going to cost, right? So if you're able to make sure those pricing tables are updated, make sure you're using the latest and the greatest, make sure that the patient understands insurance will cover X and Y will be your responsibility. You almost have to really break it down for them, because patients don't understand their own insurance. and it's very confusing. I have a lot of healthcare costs that I incur throughout each year, and I still don't always understand my bills. And I'm an expert at it because it's my job to understand. It's my job to educate you, and I still don't understand a lot of times. So you have to almost really break it down, just the way I'm breaking it down with you guys today in the session. I might be covering some very basic stuff, and you're like, well, yeah, that makes sense. And yes, we should be doing this. But I would challenge you, if you really started investigating your process and your procedures, I would challenge that you might find there are some loopholes in there. And it might just be simply because, well, we didn't know we were supposed to do that. So definitely break it down to the ABCs and the 1, 2, 3s if you need to. Securing those payments, of course, you have to tell your patient that it is our policy, because of the type of ongoing treatment you are receiving, Mrs. Leon, it is our policy that we keep a card and or a bank account on file. And just remind them, again, I mentioned, bring their defenses down, remind them that you will definitely alert them, you will inform them before anything is charged. Point of service communication is so very important, when you are coaching your patients. And then we have to we have to switch our mindset and then move over to coaching our staff, right? And how do we do that? Well, we have to ask ourselves, how bad is the situation? How much bad debt did we write off last year? Who's going to fix it, right? Who's going to be responsible for communicating our new policy to our staff members? Who's going to write scripting? Who's going to provide talking points? Who's going to do all of this? Because it's not just the billing. It's not just a billing function anymore. If it gets to the billing department, it's almost quote unquote too late. And so you really have to think about, who can I assign, who's going to be a rock star at this, and who is going to follow through with this policy? How will we fix it? What's our policy going to be? So asking yourself, going through that exercise of asking yourself these questions is a really great exercise. And then you can kind of mind map and map out who is better at this versus this. And then that's how we, move into coaching our staff. It really is, for your staff, it's a culture shift, because you're going to hear comments from your staff that say, well, we've never done this before. Why are we changing? You're going to hear that from your patients as well. So if your staff is not prepared in knowing what your charge is in changing your collections policy, then they will never know how to answer the patients. They will never know how to stand confidently in what your message needs to be. So the collection of those patient balances, one thing to remind your staff is, if we collect more from our patients and write off less, how does that change how you're able to give back to your staff or give back to your business? If you wrote off $500,000 last year, what would it look like if you had that $500,000 back? What could you do for your staff members? And I've said this a few times already in the entrance of the slides, is, it's not just a billing department function. We can no longer bill the patient, and that mentality should no longer exist. Yes, we will bill the patient, but we have to secure the asset as well. So determine your policy. What type of equipment or service is going to be made mandatory? This is a key thing to determine and map out, is what type of equipment and service will be made policy. Is this a patient who's going to be on ongoing service? Then they should absolutely, and they're going to always have, their copay due, they should absolutely have some sort of payment on file. And then, of course, training. I work with providers all day long about scripting and training and talking points, because they come and they say, well, we don't know what to say. And it really doesn't need to be that difficult. It really is a simple talking point. It's having the right person say it. Because if you have a billing or an intake staff representative who is standoffish or upset that you're making them change the way they're used to doing things for the last 10, 15, 20 years, they're probably not going to exude the message in a positive manner. and which is going to really set your patient off. And so it's extremely important to make sure that you have the art of the talking points established, and make sure that you're arming your staff with those scripting points. And then how do we make sure they're doing what we've asked them to do? Of course, regular check-ins, KPIs to measure the objective at hand are extremely important when you're going to change your policy. Transparency is key. Tell your staff why you're changing. Shift the mindset that we will bill and chase later, and that is going to be probably the biggest challenge. It's not going to be with your patients. Do not let your staff convince you that it's the patients, because the patients have to pay for other services. They understand that. Make sure that you know that a lot of your hangup is probably going to be internally, and so I definitely caution a lot of providers to take that aspect seriously. Developing a plan, right? Determine your policy and useful tools. We are one team and we all have the same message. And the same message is that we all work together, like this puzzle piece on the screen, right? It's no longer business dev over here and ops over here, billing and logistics over here. We have to all work together. I have a story, just a quick story before we move on to the next C, of a provider that I worked with down in the South. This is when I was still traveling last year. And they said to me, I was doing the training in a couple different, in billing there was 2 billing departments I was training and 2 intake teams I was training. And I had one of the young ladies sitting in the session with her arms crossed the entire time while I was going through all the scripting. I had handouts. It was very detailed oriented. And at the end of it, she looked at me and she said, well, if I'm doing this, what is billing doing? And it really made me think about just that whole culture shift with the staff. And I reminded her that we're no longer going to silo ourselves or segregate ourselves from different departments. Rather, we're going to work as a unit, as one team. And as you can imagine, of course, the conversation afterwards with the management team, that was brought up, and I did warn them that you might have a little bit of an issue with this one person taking on this new strategy. So just keep that in mind. We want to find the rock stars. We want to make sure that we have advocates internally so that we can change our collection strategy externally. So catering, what do I mean by catering? How can we cater to our patients? How can we cater to this new standard of collections? We all know healthcare bills are confusing, right? It can be hard to read. There's a lot of insurance noted and credit memos and adjustments. And especially if I'm elderly, right? If I'm an elderly patient, I'm going to have an even more challenging time reading through my healthcare bill. So I will, this next section is really all about making sure you're catering to your patient's need and their understanding. And I've kind of mentioned and prefaced early on that, I get a lot of healthcare bills. The reason I get a lot of healthcare bills is because I am a patient too. I am a 2-time cancer survivor. I have Lynch syndrome, which is basically just a genetic mishap of my DNA, and it causes me to contract cancer. And I was 26 at my first onset, and I was 37 at the second. And it really disrupted my life. As you can see, I'm sharing some images of me. I'm extremely proud of myself. I'm extremely proud of where I am now at the age of 43. I've beat cancer twice, and hopefully my time is been checked off as far as cancer is related. But I always have to be on guard. And so I am always going to the doctor. I developed a blood clot shortly after my second surgery. I developed 2 years ago, I went back for a third surgery and had an intussusception of my intestines. So this is something that I will live with every single day of my life. And I have a 13-year-old and a 7-year-old. So it is extremely important that I stay up in my healthcare. And so I do receive a lot of healthcare bills. I get that they're confusing. I understand that it's so hard to navigate through those bills because there's so many different things on them. One thing I will say though about the collecting up front, is every year I go to KU Med and I have a colonoscopy, endoscopy, and a double balloon enteroscopy. And then I follow that cocktail up with swallowing a capsule with a camera in it that travels through my intestines. As you can imagine, all of those procedures are in the tens of thousands of dollars. And every single time I go, they always ask me for a card on file and a $50 deposit. Even though I know what the drill is, and even though I know that my insurance is going to pay, and even though I know this $50 is not even going to make a dent in my services, they're still teaching me and setting the expectation with me at the time of service that I will have a responsibility for the services that are being rendered. And yes, it might be a little bit of a different experience with my hospital experience versus the way that you're working with your patients. However, it is the same concept. Making sure that we set that expectation with the patients is absolutely key each and every time. So catering to them through easy to read communication, right? We want to make sure that your statements that you're giving to the patient, when you're sending the statements out, that they're easy to read. Do you have a bill pay site? Are you able to market that bill pay site, making it even more easy, or making it easier rather, for the patient to get online and pay their bills early if they want? A lot of times I receive bills that have no way to pay. And actually I took my daughter to an orthotist the other day because she has a cracked growth plate in her heel. And I got the bill the other day, and sure enough, there was absolutely no way to pay. Now I'm in my 40s, so I pay everything online, or I have everything automatically paid. And I was disturbed by the fact that I couldn't just make it and pay the payment. So I had to stop what I was doing, call in and ask, "Do you have a bill pay site? Can I just pay this online?" And she said, "Unfortunately, we do not." And I was just really surprised that they're a well-known clinic here in Kansas City, really surprised that they didn't have that. So make sure that if you are able to collect those payments online, if you do have a bill pay site for your patients, make sure that they're able to find that easily. And the best way to show them where that is on the statement that they're receiving every month. If they're getting something in the mail from you, make sure you're able to show where they can go to receive that information. We believe statements should be easy to read, and they should have everything on them. They should have a current due. They should have a past due. They should have anything that might be ready to be sent to phone collections. Be very transparent with the patient balances, because if they don't understand the statement, it's going to delay their payment. Maybe you send statements out. A lot of providers send statements out at the end of the month, right? You do billing at the end of the month, and that's not always the best way to manage your cash flow. And while this might not be catering so much to the patient, it does cater to you as the provider, because if you can send your statements out via alpha split, if you think about splitting the alphabet up in 4 weeks and sending, A through like L the first week, and then the second week you send L through R, and then R through T, and then T through Z, or whatever it might be. Think about how that helps even out your cash flow. Think about how that helps your phone collections, the team that's answering the phone whenever a patient has a question. It helps stagger that out, and then it allows your team to better keep up. And so while that may not be catering to the patients, it definitely does help cater to you guys internally. But then all of your patients aren't on long hold times waiting to get through to you to ask a question because you've alpha split the statements out. So something to think about. And then offer e-delivery. Notification of a bill ready to be paid through e-delivery or text message, that is where we are going as an industry. It is going there. Just like they did when we went into Walmart and they would run your check through the machine and they would hand it back to you, right? We as a nation are looking for faster ways to be notified of everything. We don't want to deal with paper, and I do understand that you might have some elderly patients, and maybe your patients really do like having paper. It's not going away, but it's going to start to trim out. And in order for you to keep up with the industry changes and keep up with what your competitors are doing, you have to have better and quicker ways to notify your patients of their balances due. So definitely something to think about as far as patient communication. So I mentioned a bill pay site. I mentioned, you know, my own bill pay. I like to be able to just jump online and pay my bills very quickly and easily. Do you have a bill pay site? What does it allow your patients to do? Enable your patients to be self-sufficient when they can pay their bill, jump online whenever they want at their leisure. Extremely important. Does your bill pay site allow them to reference it in the future, or in the future if they need, for a past due balance or for a past payment that they paid, a payment history? Does it save all of that payment history for the patient? That is definitely another way that we can cater to those patients. Making sure that they have all that access at their own fingertips is key. Payment methods, payment plans rather. Is your bill pay site set up to allow payment plans? And this is fairly new to healthcare in general, because I don't think that we want our patients to set up a payment plan for $5 a month on a $5,000 balance. But if you're using the right, if you really are looking to solutions to help you manage, you know, the thresholds of what the patients can pay, there are solutions out in the market that allow for that. You do want to cater to your patients, giving them the option to pay in 2 or 3 or 4 monthly payments, but you definitely don't want that balance to extend 6 months out with just small monthly payments once a month. So definitely something to consider if you don't have that ability today. You want a bill pay site that allows your patients to save their payment methods on file. If you don't have that payment method on file, the ability to save that, then your patients are going to have to, every single time, they're going to have to go and save it, or gather it up from their purse or their wallet every time they're paying. And that's really frustrating to the patient. So make sure you allow them to be able to save save their payment method on file. Viewing of the statement, this is extremely key, right? Because I'm sure some of you are on the phone, and I wish I could see faces right now. But I know whenever I ask this question in a crowd of people, I always say, okay, by a show of hands, how many of you experience this phone call at the end of the year? I need a copy of every single bill I've paid sent to me or emailed to me, right? And then you have to go back into the patient's account, print a year's worth of documents, and then put it in a 9x12 envelope, or if it doesn't fold, if there's so many pages, it doesn't fold up into a regular standard envelope. And then you put $2 or $3 worth of postage on that envelope, because now stamps are 55 cents for a first class stamp. It just does not seem very efficient. And if we could give our patients that access to print their own statements from their own home computer, blow up their own printers and use their own ink cartridges, think about the savings you guys could witness, not only in the supplies, but in the time of your staff doing that. And so you really should be giving your patients the access to do that. No, you should no longer be printing those and sending those to the patients. They should be able to do that themselves if they have an efficient bill pay site where they can manage that. And then, the e-delivery, of course, and the card on file I've already talked about. If you allow, and while my charge here, gang, is that you ask or make it a requirement that the patient give you a card on file, especially for a recurring service type of patient or recurring patient in general, then you can set that standard from the point of service, from the date of service at intake. However, if you also give your patient the ability to do that on their own terms, that is also going to take their defense down. So if you have a bill pay site and allows them to make a payment, but it doesn't allow them to do the following bullets I've talked about, and even the bullet of them signing up for e-delivery themselves or saving their card on file themselves, then you could really be missing out on a key bunch of patients that would do it if you allowed them to do it on their terms. And I don't want anybody to misconstrue my question, but I want to make sure that you guys understand First, we try to make it a mandatory question that we're asking the patient, right? What form of payment method can I save on file for you today? And can we have an email address so that we can email you notification of the bill when it's ready to be paid? If they fight you and you decide to allow them to skip over that step at intake, that's fine, but make sure that you have the opportunity for them to do it later on the bill pay site. Because again, a lot of times patients just want to do it on their own terms. And while we will try to set forth better practices and standards as a billing team and intake team, we do want to make sure that the patients have the ability to do it on their terms. So here are 3 bill pay sites that I collected from online, from providers in our industry, in our space, that all have bill pay sites. So look at the top one. Would you ever know that they have a place for you to pay your bill as a patient? I'm guessing many of you are saying no. The middle one, look at the middle one, right? So the middle one is a little bit better. It has make a payment on the right there by the icons, the social icons, right? It says there in white letters on a red background, make a payment. But then the third one is even better than the top 2 because it actually says pay your bill online. That's what I mean by spelling it out, right? We have to make sure that if we offer a bill pay site, do not make it hard for them to find. Don't bury it within a menu option, within another menu option, within another menu option. I assure you, your marketing team and your IT team, it does not take much to create a bill pay button on your menu bar. And your marketing team, will thank you for the activity on the website. So I then ventured upon 2 other providers that made it so explicitly clear I had to share the examples with you guys. These 2 boxes I pulled directly off of the websites of providers that are, well within the healthcare realm, not directly related, possibly to the home infusion marketplace. But I wanted to provide this just as an example that these are 2 providers where they're spelling it out and making it easy for the patient to understand. I love when I enter a website, when I go to a website and I can make a payment easy, or I understand how to navigate through the site. We tend to make it so difficult and so challenging. And that might not be because we're trying to make it challenging for them to navigate, but it might just be that we haven't really broken it down and thought through, is this easy for even myself to get on and find out where our solution is? So I hope everybody right now is going to your own internal, your own homepage and finding if you have these solutions. If you have a bill pay site, I hope you're pulling it up right now and saying, I wonder where our bill pay site button is. And if you find that you cannot find it, I would take that down as an action item to fix. So some different ways, of course, that we are catering is through the bill pay site, but also making sure that they have payment options. I've already talked about this a little bit in the presentation, but sending those, if you're offering payment plans, how are you offering them? Are you sending out paper every month reminding them to pay? Are you waiting for them to make a payment because you sent them the bill? I sent them their bill, they just haven't made their payment yet. If that tends to be your kind of the thing that you're always witnessing every month is you're sending the bills and they're not making good on those payment plans that they agreed to, then you need to look to change that, right? Look to change that and make it more efficient by offering electronic payment plans. This cuts out so much cost for you. If you think about it, when the patient calls and they say, I'd like to set up a payment plan for this balance, I can't pay it all today, and you agree to that and you set up the payment plan for them, if you save a card that's attached to that payment plan, then you no longer have the paper cost of sending out the reminder of the bills, the payment plan bill. You no longer have the cost of the stamp that is needed to put on the envelope to send it to them. And then you no longer have the cost of your own staff doing all of that work. Once that staff member sets up that payment plan that suits the patient's ability to pay and suits your threshold of payment on the balance, then it literally should be a set it and forget it type mentality. We know that paper isn't going away, but I would encourage you guys to look through and find better, more streamlined ways. If the patient needs a payment plan, offer it in a streamlined and effective manner that suits your business needs and your business initiatives and goals to get paid. Stop sending out paper and hoping that the patient is going to make due on their promise to pay. That's a real big one for me. But I am always talking about saving cards on file whenever you can. So, I know, and I just want to make it very clear to the audience that I understand there are going to be exceptions. Of course, there's exceptions to everything. But I think what has really challenged providers that I have seen is that we make too many exceptions. We don't have the buy-in as to why this is so important. So, I could be on my soapbox all day long. If Jennifer and the NHIA team would give me, a whole day presentation, I could just talk to you guys all day about different strategies and ways to collect. So I'm going to keep this moving so I don't lose my crowd here. So payment options, I mentioned, payment plans, right? I mentioned how you should have flexible payment plans. If you want to send paper, that's fine. I don't think that it's the best way to collect. However, we do know there will be exceptions. But if you're sending electronic, if you're going to agree to an electronic payment plan, how do those payment plans look? And what I mean by that is, do you have different types of electronic payment plans? For example, if the payment plan is fixed and you know that the patient's balance is $1,000 and you've agreed to collect, $250, 4 payments of $250, then if they get another invoice that drops to their responsibility, is it going to catch new balances? Probably not, if it is a fixed payment plan. Whereas if you're using more of a dynamic kind of rolling payment plan, a solution out in the market where you can capture those new balances, then it's really easy for your staff to manage that balance for the patient, and it's easy for the patient because then they know it's just going to kind of roll in. Now, the last thing you want to do is have a never-ending payment plan that just always is rolling in for the patient. However, there will be some of those exceptions out there. You definitely don't want to make that a standard. The best way, though, obviously, is having that card on file. I call it auto pay or card on file, method of payment. There's all kinds of different acronyms you guys can call it. But if you have that card on file and you set it to where it's going to charge that card every time a balance drops, that, of course, is going to be the best way to collect and to cater to your patients, because while I know that you do have elderly patients, the thing to consider is the number of baby boomers that are entering the healthcare market on a daily rate. I think the last number that I saw out on a survey was like 10,000 a day. That's a staggering number. And if you think about the baby boomers and some of you even on the phone, you want easy ways to pay, and you're no longer in kind of that antiquated way of doing things, that old school way of doing things, and you're accustomed to having quick and efficient solutions. So definitely something that you should keep in mind when trying to make a better collection strategy. So collecting, how are we going to make collecting easier, right? That is the last C to the session today. And I wanted to bring forth a few ideas today very quickly. As we approach the top of the hour, I do want to make sure I'm leaving plenty of time for questions if questions have come through the chat. But reminder calls, are you guys reminding your patients to pay? Now, I'm not talking about Sue in billing has to make 10 calls a day, to satisfy a quota, or 50 calls a day, whatever it is. I'm talking about doing that through an IVR system. You cannot pay an hourly employee a rate to make these calls. It's not a sustainable model. So looking to outbound IVR calls, looking for inbound IVR calls, provide payment options. Maybe those calls are asking the patient for a new updated insurance card if you have an old one on file. Maybe the IVR call is, as we have in our appointment reminders, right? They're calling to remind me of an appointment, or even better, a text message. I love getting text messages for my appointment reminders because I typically don't, answer the phone a lot. So, but having these IVR reminder calls is key. And I wanted to play a sample. I'm not going to play the whole call, but I just want to play maybe the first 30, 45 seconds of the call for you guys to hear of what's available in the market.
This call is from Nations Healthcare. Your account requires immediate action.
Sorry, I paused it.
Is this the residence of Jennifer Moore? Yes. Am I speaking with Jennifer? No. It's very important that I speak with Jennifer regarding their Nations Healthcare account. Is Jennifer available to speak? Yes. Okay, I'll wait. We have important information about your Nations Healthcare account. Due to the sensitive nature of your account information, we will need to verify your identity for security purposes before proceeding. Please provide your date of birth. 12/19/1967.
Okay, so I'm going to pause the call because it's a 3-minute call, and I definitely want to be cognizant of our time. But that call, as you heard kind of early, it was starting the verification process, right? And look to solutions in the market that are smart enough to understand, they call it intelligent learning in the IVR space. Look to solutions that have this intelligent learning that can adjust to the patient's questions, that can, if the IVR doesn't understand, of course, the patient, then it will also, say, I'm sorry, I didn't get that, and ask the patient to repeat it. So I'm not just talking about a standard robotic call. So make sure it's a bit more interactive, if you will. Here's a case study with a customer that they gave me permission to share their information. Of course, J&B Medical Supply uses these types of calls. They were using it for, pump records, collections, refills, script reminders, patient surveys. They really did cover the gamut when it comes to ways that they could use these calls. And their results then are on the right-hand side. They were able to authenticate the patient 70% of the time. 95% of their callers were engaged. They automated 75,000 conversations a month. 75,000 conversations a month. I mean, think about that number. Think about, we all know that machines can do stuff a lot faster than the human person can. And I'm not talking about replacing your staff or getting rid of your staff. I'm talking about making their jobs more efficient. By having this technology, then you're able to allocate them to other duties throughout the day. They don't have to make these reminder calls, and they don't dread making these reminder calls, and it makes a much more efficient solution for you as a provider. Another way that you can obviously try to collect is with those live agents. And I mentioned, human resources are expensive. But if your business requires, if your business is not something that can accommodate an IVR solution, and you really want that human personal interaction, look to outsource that type of functionality. Find a team that can, and maybe you have a team internally, right? And you just dedicate them as live agents. Like, you will be the team that interacts with our patients. You are the team where the phone calls go to. You are the team that calls our patients to work this bad debt. You are the team, instead of intermingling that duty amongst different functions within billing, if you can dedicate a team to doing that, then that really allows you to focus in on the initiative at hand, and then you can really garner some great results. But if I as a customer service rep or a biller am made to focus, if I have 17 different things I can work on a day, I'm a bit spread out, I'm a bit sporadic on what I do. And if collecting from your patients is one of your key initiatives because, you know, the reimbursements just aren't where they were, where they used to be, then you have to dedicate and make and set aside a team to do that for you. And there are teams, you know, you can do like short-term projects, you can do cleanup work, you can do whatever, but definitely meant to complement your current billing strategy, billing and collection strategy with a live agent if needed. And then of course, collecting out in the field. So I know that a lot of us in healthcare, you know, and I know now is a little bit different with the pandemic going on, but we were making house calls and house visits, and even still, right, we're arming ourselves with protection, and we still have to be there for our patients. If you are unable to, you know, collect all of what I have talked about for the last, you know, 50 minutes or so, if you're unable to collect that up front, then make sure that you're arming your field staff with a way to collect that through a tablet or a mobile device. Make sure that you can take all sorts of forms of payment. I always say, you know, you take their firstborn if they give it to you. Make sure that you have every way to collect with an ACH, a credit card, e-checks, those health spending cards and flex spending cards. Everybody loves to pay their healthcare that way. That's the only way I pay for my healthcare until I hit the limit throughout the year, and then I have to. Usually come October, I have to pay the rest myself if I haven't hit my max out of pocket. But make sure that you're allowing the ability for your staff to collect in the field, whether that be at home or if you're working with hospital groups and you've got hospital liaisons in the hospital working there for your organization. Very important. So as we come to the end, you know, go over this 4 C's just very quickly. Again, we're going to change your outlook. We're going to change our outlook on why we need to collect, why it's so important for us to collect. We're going to coach to our new policy, coach internally and coach externally. Coach your staff first so that they're equipped to coach your patients next. Offer solutions that cater to your patients' needs. Make it easy for them to pay their bills. Make it easy for them to communicate with you. The last thing we want to do as a patient is call a billing number and be directed through a phone tree of different solution sets, right? I just want to call to pay my bill. Make it easy for them to do that. Make it easy for them to do that online, and then you collect your money. I'd like to leave everybody with a quote that I just love. I remind myself of this daily. The least expensive time to collect is right now. It gets real expensive to collect that money tomorrow. Think about that. You know, it's so much easier if we collect at the time of service, if we secure a form of payment at the time of service, whatever suits your business model, if it's collecting up front, securing up front, offering more solutions to your customer base, whatever that looks like, it's a lot less expensive to do that in the beginning than it is to try to chase that down later. So with that, I've got my thank you slide up with my information on the screen. I don't know, Jennifer, I'm going to open it back up to you and see if there were any questions that came in through the chat line. I'm happy to answer them. And if we've run out of time, of course, happy to answer them also after the fact and send answers after the webinar. But thank you guys all for attending today. I appreciate it very much.
Yeah, we have just a couple questions, so I think we'll be able to get through them.
Okay.
But to the audience, if you have a question, please send it in, because if we don't get to it, I'll send it over to Jen, and she can answer you individually. Thanks, Jen. That information was amazing. One of the reasons I love the summer series is how much I'm learning about all the technology and things that are out there. Those calls were just amazing. I had no idea. So here, from one of our audience members, you mentioned keeping payment methods on file for future reference. Possibly it's just their policy, but they're not allowed to keep credit card payments on file. They have to destroy them after running the card. They do follow PCI security standards by their credit card company processor, but are there laws? Can you kind of explain a little bit about how you would do that?
Sure. So you are actually able to, as long as you are keeping well within the credit card security standards, PCI compliance, if you are keeping those credit cards stored in an encrypted platform, if you will, then there should be no need for you to have to, quote unquote, destroy the credit card after. The way that you get around that is the card numbers in those compliant PCI solutions are tokenized. And I definitely don't want to speak on the state rules and regulations, wherever this question may have hailed from. Definitely something to go over with your legal and your compliance team with. But I can assure you, based on my experience in the industry and the solutions that I have come across and the solutions I've used, as long as those cards are being tokenized and that number is not available to your staff after it's entered into a system, then it is absolutely well within PCI standards and compliance.
Thanks, Jen. So this is a challenge I think a lot of home infusion providers run into, is that you're really talking to the patient up front about what their cost is going to be, and then lo and behold, they're like, forget it, I'm just going to the doctor's office or the hospital where they don't have that same requirement, and they're not really told all of that up front. So do you have any best practice on how you talk to patients should they start to go down that road?
Yeah, and that's that kind of referring back to that puzzle piece of biz dev. This is going to be really key for this situation. This question is making sure that our biz dev people, as they're going out and securing relationships with doctors, offices, hospitals, and looking for those referral sources to be coming over into your new set of business. You know, the doctors, they're collecting up front. They're collecting some sort of either securing a card up front or collecting up front. So they're able to collect, and they understand that you have to get paid also. And so if your patients are coming back and saying, well, you know, and you see more times than not, the quote unquote doctors aren't telling us, then maybe it's a conversation you need to circle back with the referring physician on and just tell them, you know, hey, we appreciate all your business and we've been able to treat, you know, X amount of patients throughout the years, and we've just really enjoyed working with you. We are changing our policy at the top of the year, and we're going to start requiring some sort of payment method be kept on file or secured for the services that we render, because we find that, you know, last year we had, you know, 75% of our debt walked out of the door without obtaining it up front. And so I think it really is just keeping an open, honest communication with your biz dev team so that they can communicate that along with the referring physicians and the partnerships of the different organizations you're working with to get those patients.
Thanks, Jen. And we just have one more question. Can you just explain how you would bill the patients up front when sometimes you don't know what the deductible is, or if it's not a copay type?
Yeah.
How does that work?
That's a great question. And when you don't know what the patient is going to owe, again, I'd encourage to check on one, what's the policy with the payer? What's the policy of your own organization? What does the state require or allow rather? But if you can take a deposit, maybe they're leaving with an expensive pump, or they need this type of pump in their home, or whatever it might be. If you can take a deposit on the equipment itself, then that kind of helps set the stage of that they're going to owe something, right? So taking a deposit would be something I would encourage you to look into offering, as well as maybe you don't even take any dollars that day, but rather you just secure a bank account when you know what they're going to owe. So there's really two sides of it. Taking a deposit if you can within, you know, legal and compliance regulations on expensive type pumps, and or collecting some form of payment and not charging it until you know what the deductible has cleared and what their copay would be my recommendations.
Great, thanks, Jen. And we did get one more to squeeze in here. Just if you have any best practice of what people kind of strive for as a reasonable amount of bad debt.
Oh man, that's a question all over the board. You know, I have seen providers write off $1.5 million in bad debt and not blink an eye because they're so large. I've also seen a smaller provider write off $25,000 in patient debt, and it could have saved their business, right? I mean, it's so across the board. I really do not have, I hate to answer a question without an answer, but it's so, we see so many varieties. It's so hard to pinpoint. I mean, obviously I would, if I was a business owner, I'd love to stay under, at least, 10% of my bad debt being written off. I'd love to see how I could challenge that number a little bit and get maybe down into the 8 to 5% range. But, it's going to be, again, I don't know what payers you're accommodating. I don't know what that cash flow looks like. And so I would just recommend trying to find what best suits your organization, because everybody is different. A different dollar amount means something to everybody else in a different manner.
You're
So
absolutely right. Thank you so much.
For
It's a little bit of a trick question, but I think letting people know that we're all in the same boat, it's always a little bit different, and just striving to do better next year.
Yeah.
So that was the last question. So again, I just wanted to take a moment to thank Jen and also Brightree for sponsoring this informative webinar. I know I learned a lot, and we always like having you speak for us, Jen. So thank you for talking with our group.
Yes. Thank you guys for having me today.
Thanks to all of our home infusion providers who are out there keeping our patients safe at home. Enjoy the rest of the summer, and we'll be back with you with more education.